So ZUMA-3 is a single-arm phase 2 clinical trial of brexucabtagene or autoleucel in patients with relapsed or refractory acute lymphoblastic leukemia. At this conference, we are presenting the 48-month analysis. Pretty much after 4 years of follow-up, what did we find in the ZUMA-3 trials? Some of the earlier presentations have demonstrated the response rate and some of the toxicity profile and how tolerable they were in ZUMA-3. But here, this is an updated analysis of how patients were doing multiple years after that one-time therapy. And the interesting finding was that there was really no new toxicity. It seems like all the toxicity that were expected were already resolved by this time. So of the 78 patients that were included in this trial, 57 patients responded, and we now have longer-term data. Of those 57, 14% had allogeneic stem cell transplant, and of those 14 patients, 6 had toxicity and are no longer alive. So there seems to be an excess mortality in patients who had allogeneic transplant. Now, of those who did not have allogeneic transplant, we continue to watch them in follow-up. Many of them are still alive and doing well. So it seems to be that they didn't have the same toxicity profile that was seen in those who had allogeneic transplant. So overall, what we found is that patients who had blinatumomab previously, before they received the Brexu-Cel, it seemed that there was less response rates in those patients, and there seems to be higher infections in those who have blinatumomab before they had the brexucabtagene or autoleucel. What we also find is that those who have multiple lines of therapy, in other words, those who had one line of therapy before Brexu-Cel and those who had multiple lines of therapy, it seems like there were more infections and more adverse events in those who had more lines of therapy, suggesting also that we really want to try to give CAR-T patients earlier rather than later. When we give it later, we have more complications and that it doesn't seem to work as well. I think it's an interesting meeting, and we are finding out really cool results from non-chemotherapy approaches. There's some updates of obe-cel, which is cell therapy in ALL, which is good to hear. There are also updates about bispecifics that are also showing good activity. I think it is refreshing as a whole to see that the field of therapy for cancer is beginning to move away from chemo to more of these personalized, targeted, and cell therapy approaches, and we are having some durable responses with them.